About 15 years ago, we started trying to treat pain more in America through our providers by prescribing opioid pain medicine. And with the increase in opioid prescriptions came a parallel increase in opioid misuse and abuse. In the last 3 years, the misuse and abuse of opioid pain medicine has translated over to heroin products. We know that based on death certificate data, and comparatively, since 2013, there is triple the amount of heroin, opiate overdose death, and use in America. Heroin comes with a fatal price that it's laced with fentanyl products, and these fentanyl products make it much more unpredictable. When you overdose, you really need, with fentanyl products and today's heroin and the purity, you need 3 to 6 minutes to get treatment, which is to get the medicine that you need to reverse an opioid overdose with an antidote. That antidote comes from the naloxone family products. This is one of those products. It's a nasal spray. It's very simple to use. It just goes up the nose. You push with your thumb and your finger, and you spray the medicine up your nose. It's absorbed, it goes to your brain, and it pushes off the medicine that's telling your brain to stop breathing. And you begin breathing spontaneously, and then we activate the medical system. The number one thing we can do to stop the deaths is to get the medicine into the homes. 54 to 56% of these overdose deaths are happening in homes. And the prescribing has to be something we go to doctors that are aware of this and that have other options, and look at public health departments and advocacy groups to support treatment for people who have substance use disorder.
This is my son, Greg. Unfortunately, in May 2012, I lost him to an accidental heroin overdose. Greg was a great kid. He was an AP student. He was a good athlete, and he did what many young people are wired to do. He pushed boundaries. He experimented with illegal drugs, and he went through a progression which eventually led him to heroin. His heroin use took him to some bad places, but he decided he didn't want to live a life depending on heroin any longer, and he got sober. He had been sober for 17 months, and he ran into some old running mates that he used to use with. And unfortunately, he made a decision that proved to be fatal. He decided to use one more time, but in the intervening time in that 17 months, the drugs have gotten stronger, and his tolerance to those drugs had lessened. So he overdosed, and the people he was with, they put him in a car, they drove him to a hospital, and they left him there in the parking lot in his car. They didn't honk the horn, they didn't go ring the bell at the emergency ward, and they didn't leave and call 911 and tell him to look in the parking lot. He was discovered about an hour later, and they rushed him into the hospital to try and save his life, but unfortunately by then it was too late and he had died. A couple days later, I met with the officer who investigated Greg's death, and he told me that if we had a 911 Good Samaritan law or a Narcan law, your son might very well be alive today. In the aftermath of Greg's death, I decided the best way to keep his memory alive was to advocate to save lives, and the best way to go about this was to make sure we could get naloxone into the hands of the community. Loved ones and parents who had people still, with somebody who was still struggling with use. If we could get it into their hands, many of the overdose deaths occur at home, and a parent or a loved one could administer that, call 911, and seek further medical attention. Well, the best thing they can do is they can go to the local pharmacy. In many states, there's a standing order that will allow loved ones to get a Narcan or a naloxone over the counter without a prescription from a doctor. There's also a site, shatterproof.org, that they can go to for more information. And in most states, they can go to the Department of Health and Social Services and typically find some information there as well.
You can also go to getnaloxonenow.org. And the opportunity to introduce naloxone into this is part of a system. Activating the system, getting people help with the naloxone, and then getting their substance use disorder treated.